say, let's start with prolotherapy, even neural prolotherapy or neurofascial therapy or neural therapy. It has its place. And there's some people, the older generation, Dr. Matt, sometimes I just give them a bit of prolozone and some neural fascial therapy, and these guys do so well. If I give them PRP, they flare up. They have this massive, reaction for days and days. And I don't know if that's just because of age or possible, problems with the immunomodulatory system that they have. But give us these out of 10, 10 being brilliant and 0 being not so good, because I think it's really important. You've got years of experience, and take us through, and then we need to discuss what exosomes are and V cells, but just take us through a category of effectiveness and cost.
Okay, and then I'll give you also a little bit of upside downside, and then what to consider.
Good.
So then Prolo is, I think, an amazing modality, and then we just stand so much on their shoulders, just like I said. Downside is there's a vessel that runs over the C6-7 facet almost always. You pick any part of the body, and then I'm going to tell you where there's a blood vessel, and then what the 3 most common anatomical variants are. And so then basically what happens is for all Prolo, there's a somewhat of a risk that there could be a vessel there that you could damage. And so then that's the only slight worrisome thing. And so then ultimately I'm pitching, and we're starting an education course where we teach ultrasound online. So then I'm like, I want to pick up 500 people in Africa, and then we're going to do something special along those lines, and then kind of push this information out, because as fast as
and I think that's brilliant education. I want to stop you there. Those that have been trained correctly, and I did my time in Mexico, registered with AAOM, passed the exams, became certified in it, never had a single long-term side effect in 29,000 sessions. Is the risk significant? Because people are going to hear this and come to us without ultrasound guidance and fluoroscopy, or do you see significant side effects? Because the people that trained with me, and maybe it's just training or anatomy, the years that it took us, the hours that it took us to get, certified by the AAOM, we speak as colleagues, we don't get long-term side effects.
So then there's two super interesting aspects to that, and that's a very good question. One is, I have had 200 conversations with someone like you that has done this, and the teaching is incredibly good at Hackenham Well, and so then for people who follow sort of those guidelines, you see people who do it 25,000 times and they don't have any complications, which is crazy. Because if you could do something 100 times and not have any complications, you'd be doing pretty good. And so then you've got that going on. There is, I've seen some people who have gotten tons and tons of Prolo that will seem fairly damaged when you look at them under ultrasound. And so then I believe that we're pushing an agenda of visualization when possible, and it is a safe thing that is super good, and at a price point that I think is super doable. And so then this is a educational and a data gathering journey that we're going to be on for the next 20 years, and then we're doing this across a whole bunch of socioeconomic levels. And so then let's say you got that NeuroProlo. I love John Liftoff. He came to my office, and I had a great time with him, and we kind of just spent a couple of days. I showed him ultrasound, and we were talking about everything. The knock on PRP is that I've had 200 people tell me, the plan is we're going to do PRP. You're going to go away. You're going to hurt like hell, and I don't want to hear from you for 3 weeks. That was like the storyline that people had. The dextrose that you use in Prolo is like kind of 15-ish%. They found that that's fairly irritating for nerves, And so then they were like, well, what would be the ideal concentration of dextrose to use around nerves? And then they said 5%. And that has been something that was fairly broadly adopted by everybody. And interestingly, there's one theory that is that the dextrose has a benefit just in terms of providing some calories in that tissue. There's a theory that in areas that are chronically vasoconstricted in terms of the blood flow in because of, let's say, chronic pain, and decreased blood flow in, there's something called glycopenia. So there's not enough sugar in those tissue beds. And so then when you use fluid and open up a fascial plane and put some sugar in, now the sugar actually is helping to basically reboot and reset those tissues that haven't had enough sugar coming in. So then this is a theory. What I found when I saw, and I was sort of an early practitioner of NeuroProlo, and what I found is super helpful. Like in the short term, how helpful is NeuroProlo? 8 out of 10. In the long term, how helpful is it long term? 2 out of 10. And so then when we first did it, it was like we were doing it and someone was in pain. It was like, and it would be immediately gone. And so then you thought, oh my God, this is the greatest thing that's ever happened. Then next thing you know, it all came back like a week later, 2 or 3 days later. That being said, and this is super interesting, I treated like the best baseball player in America like 9 years ago. I did a 5% dextrose nerve hydrodissection. So sometimes, especially when I was treating a lot of pro athletes 10 years ago, I was using 5% dextrose because that was something that was 100% regulatory neutral in terms of like the regulatory agencies that look at blood doping and stuff like that, sugar. And I treated him and it lasted perfectly for 8 months, 7 months. It lasted from spring training and all the way until August. And then I did it again, and it worked again, and then it had a real long-lasting effect. The woman that I live with, Barb, has like a kidney pancreas transplant. If I gave 5% dextrose to her, it would 100% resolve her pain, and it would all be back the next day. So then that goes to show you, I have this one person that lasts 8 months and this other person was fairly sick. If I put placental matrix, the same thing for placental matrix for Barb, a lot of times it would fix it in one time. And so then you begin to realize I have a modality. It's going to be, I'm once again working now across a diversity of what your health is. And so then I would say, the NeuroProlo is super interesting, but then also just in general, 5% dextrose and fascial planes. And ultimately, my pitch is that you really want to see where you are in those fascial planes. There's almost always arteries in those fascial planes. And historically, we always thought we wanted to be in the fascial plane and not in the muscle. But a lot of times I'll put a little bit of my growth factors in muscles as well as in the fascial plane. And then what I do is there's a nerve and an artery that are like right next to each other. And so then I put my needle and I put fluid around both of them. And so when I do basically fascial approaches, we're always treating nerves, arteries, veins, and lymphatics and muscles. And then often there may be a muscle here and a tendon next to it. And so then we'll be treating both of those. And so then because it's so robust and because all of those things tend to really benefit, then we're big fans of using ultrasound because we want to see where all of those things are. We want to see so that I don't damage any of that stuff. And then in those muscles, a lot of times if there's some fat atrophy in a muscle or some damage, or some at the central tendon of the muscle, there's a lot of nerves around that central tendon. And so then I just stick my needle right there and we'll treat that. And so then from that perspective, I find that super helpful. And so cost could be anywhere between a 2 and a 10 because we could use dextrose to stem cells. Um, effectiveness really could be anywhere between a 5 and a 10. And then I echo exactly what you said, which is that dextrose and is super non-inflammatory, which is why some of our older patients do great with that. And ultimately, for people on fixed living, then if they could come in and get that in a low-cost way, and then that's a pain relieving strategy, and then I'm going to give that a 10. Okay. And so then, managing how we sort of onboard sort of the traditional world to this as an approach to pain management as we sit here in the middle of an opioid epidemic that's totally failing, then I think that's great.
Brilliant. Let's go into stem cells. I think give us the same sort of scale in terms of effectiveness and costs, and maybe it's just some idea of costings if it's possible with regards to a PRP across the board. If you've got some idea, Prolo across the board. Obviously it's different from a cervical spine to a knee, but just some idea for people listening what a stem cell treatment costs. Exosomes, maybe explain that, or V cells.
Okay, good. So then let's say dextrose, the cost to me is dollars. And so then, those treatments are hundreds of dollars probably, but, having more people do that, I think would be an amazing thing for the world. The next one up, placental matrix, a vial of placental matrix, $1,500. Way more anti-inflammatory than PRP, probably lasts longer, probably stays in the tissue planes where you put it for months. And so people get this extended improvement with almost no flare or downside. And so then that could be, if something costs $1,500, that could be, a couple $1,000s for an injection. Let's just think $500 an injection just as a cost on top of stuff, but it could be more depending on what you're doing. PRP, there's a host of different types of PRP, and in the developing world, then you begin to realize, oh, okay, just as good in my mind as $200 PRP kits. You can get sterile conical vials that you put blood in and spin, and then you can get plasma and platelets. That's a home run. And then you're helping people with a fairly amazing product where your cost is, the cost of running a lab. And so then if you called the cost of that $50 in terms of processing, then you can really help somebody with a $250 treatment. And then I would call that, PRP is probably between a 5 and a 10. It has potential to be an amazing treatment. When you grow stem cells in a lab, if they're happy, what they do is they secrete growth factors. And those growth factors are little small vesicles called exosomes. And basically, we have signaling molecules that are almost like currency or communication within the body. And so then what is that currency? Could be peptides, could be exosomes, could be hormones, sometimes could be proteins. And so then could be other small molecules, could be kind of high energy vitamins like NAD, for example. And so then exosomes, let's say the cost was $1,500. So then exosomes are fundamentally going away in North America, but people are going to be using it topically. This, however, will over the next 20 years, I think, become one of the bigger players, just because exosomes probably are one of the most effective, super anti-inflammatory, no flare. There's one company that I had a lot of flare, but for the most part, no flare, and something that is in the ballpark of a 7 to a 10. A The stem cells, there's a whole bunch of different types of stem cells. So one type of stem cell is bone marrow. The bone marrow cells are good. The downside is they're fairly inflammatory compared to the other cells. And so if you don't like, if they said PRP flared you, then stem cells really flare you. And so bone marrow ones anyways. So then, I used bone marrow stem cells a little bit. There are kits that you use to process them. And so you think about the cost again is back into that almost $1,000 ballpark, maybe half of that. But I would say because of flare and because of things, I might rate bone marrow stem cells between a 5 and a 9, And then as we age, our bone marrow stem cells become way less potent. And so then for your 70, 80, 90-year-olds, those you're going to have a less healthy and less functional bone marrow. Your belly fat, your adipose stem cells are 20 years younger than you are because they're less metabolically active. And so then you can take and do an adipose harvest, and then you can either take some of that fat and then separate the stem cells that are in there. And there's a diversity of stem cells in there that they call stromal vascular fraction. On a scale from 1 to 10, that's just a 10. It's an amazing treatment. And then you can inject that basically anywhere. You can also take some of the belly fat and then you can emulsify it where you put it back and forth through a little filter and then mix it with some PRP. And then that's called nano fat or micro fat. And so people will do fat transfer of that to the face or to your facet joint or in your knee. The amazing thing about that one is when you do that, those adipose cells tend to stay living wherever you put them. And so then I would say rate nanofat kind of a 9 to a 10. It's a long-lasting treatment. It's the longest-lasting treatment. It's I would say it's 2 or 3 times more effective than placental matrix, which is probably the next best long-term lasting thing. It's relatively inexpensive. It's a complex process to understand how to do it, but it's relatively inexpensive. And so then if you come here, I'll probably teach you how to do it. And you're going to take that back to Africa for 100% sure. You would love doing that. And then you can, our philosophical approach to using nanofat is 100% identical to the philosophical approach of using Prolo. And so we're treating those ligament areas. And then what happens is you're putting cells that are right next to where that ligamentous laxity or those partial tears are. And then those cells are secreting exosomes. Wow. But then that's your own stem cells. And so that's been my best thing I would say I've ever experienced in terms of lasting a super long time, being really effective. And then there are some people, depending on where you are in the world, where you could either take some bone marrow cells or adipose cells, send them to a bank, and then grow those cells and then take them back. And you could either do them IV or you could do them, do future injections. And so I'm going to give that a 10 just because then that's a super interesting way to have some longevity. The nice thing about the adipose cells is that they're your own cells. And so they're living there. So you're going to feel super great about that. The price point is going to be relatively low overall. Okay. Next one is umbilical cord stem cells. And so then we've been doing umbilical cord stem cells in Mexico for a long time. There is an exponential growth in the use of umbilical cord cells and the interest in using umbilical cord cells in Asia, the Middle East, the Caribbean, and basically everywhere. And so then this is going to dramatically grow. We have a cell line that we've been using that has been an incredible cell line. and I think, I hear about all of the other cell lines, and so I probably like ours the best. The umbilical cells are probably the most expensive thing out there for IV, because if you're doing an IV treatment, you're giving 100 to 200 million cells. So it's a really huge amount of cells. The great thing is that if you're injecting in an individual joint, we might put 10, 20 million cells in there. And so then at a price point, umbilical cells could be a super high cost, but if you're just injecting some joints, it's a super low cost. And I will have, I got off the phone with somebody this morning that we love, and had a devastating pain situation, treated them with placental matrix and exosomes and stuff like that, and was really helpful, but not 100% helpful, and still not totally better. And then treated them with the culture expanded cells, and then now they're 100% apparently, and it didn't take too long. We're doing a trial, and so we'll end up doing this trial in the United States with looking at a form of muscular dystrophy, and there's going to be an article when it comes out. I'll send it to you, and you can post it along with this. But there's an article coming out, but we're doing a pretty interesting study where at a form of muscular dystrophy where I had people that were losing muscle every year, and then I got them back to where they were a couple of years ago. So umbilical cells are, between a 9 and a 10. They're a little bit more expensive, but depending on if you're treating certain things, there's ways to use them less expensively. And then the final thing is, there are some, and now in addition to umbilical cells, there are some people that are doing placental cells, but not much. And I haven't seen much of that. It's mostly umbilical cells. And those are, just so people know, those are harvested at the time of an elective C-section. And so there's really no controversy around that from a pro-life perspective at all. And then, there are some pluripotent, there's more than this, but then there's some pluripotent cells that float around in your blood. Some people call them U cells, some people call them B cells. And there's a friend of mine, probably is the world expert on this topic. His name's Bill Paspalarius. And he created a company named Tython, and they have a proprietary approach of how to pull those cells out and activate them. And there's a fairly complex algorithm. Also, a fairly interesting modality, and that's easier to get than bone marrow stem cells or umbilical cells. I would say overall in my journey, that has the potential to be super amazing, and I do love that. I do think for major structural problems, I do better with bone marrow and adipose stem cells. But I've had some great results with hair. We've had a lot of great results with sexual performance with almost all of these products, as long as they don't have any particulate in them. So we don't put placental matrix there, but work good for the P shot and the O shot. And so then, that kind of rounds out a little bit of a price point, and then a kind of a sense of all of those kind of products.